41. What is the primary purpose of a nurse conducting a health assessment on a new patient? A. To develop a diagnosis. B. To determine the patient's financial status. C. To identify potential health risks and create a care plan. D. To review the patient's medical history in detail. Answer: C. To identify potential health risks and create a care plan. Rationale: the health assessment aims to gather information to identify risks and formulate an appropriate care plan for the patient. 42. What is the best approach for a nurse to take when a patient refuses medication? A. Administer the medication forcefully. B. Respect the patient's decision and document the refusal. C. Ignore the refusal and give the medication during the next visit. D. Call security to handle the situation. Answer: B. Respect the patient's decision and document the refusal. Rationale: nurses must respect the patient's autonomy and right to refuse treatment while documenting the refusal accurately for legal purposes. 43. What is the primary responsibility of a nurse when administering medication to a patient? A. To ensure the patient is aware of the medication's cost. B. To follow the 5 rights of medication administration. C. To convince the patient to take the medication. D. To delegate the task of medication administration to the healthcare assistant. Answer: B. To follow the 5 rights of medication administration. Rationale: the nurse must ensure the correct medication, dosage, time, route, and patient are involved in the administration process to prevent errors. 44. When a nurse is preparing a care plan, which of the following should be considered first? A. The patient's wishes and preferences. B. The nurse's personal opinion about the treatment. C. The doctor's orders and medication list. D. The patient's insurance coverage. Answer: A. The patient's wishes and preferences. Rationale: a patient-centered approach requires considering the patient's preferences and wishes in the development of their care plan. 45. Which of the following is an essential component of cultural competence in nursing practice? A. Providing the same care to all patients regardless of cultural background. B. Recognizing and respecting patients' diverse cultural values and beliefs. C. Encouraging patients to adopt the nurse's cultural norms. D. Ignoring cultural differences to avoid bias. Answer: B. Recognizing and respecting patients' diverse cultural values and beliefs. Rationale: cultural competence in nursing involves recognizing and respecting the cultural differences of patients to provide individualized care. 46. A patient with a chronic illness reports feeling depressed. What is the nurse's first action? A. Prescribe medication for depression. B. Assess the patient's emotional state and history of mental health. C. Tell the patient that their feelings are a normal part of the illness. D. Refer the patient to a mental health professional immediately. Answer: B. Assess the patient's emotional state and history of mental health. Rationale: the first step is to assess the patient's emotional health to understand the severity of depression and develop an appropriate care plan. 47. A nurse notices a change in a patient's condition. What is the most appropriate next step? A. Wait and observe to see if the condition improves. B. Report the change to the healthcare provider immediately. C. Increase the patient's medication dosage. D. Notify the patient's family without reporting to the doctor. Answer: B. Report the change to the healthcare provider immediately. Rationale: the nurse should report any significant changes in a patient's condition to the healthcare provider promptly to ensure timely intervention. 48. A nurse is preparing a patient for surgery. Which action should be taken to reduce the risk of postoperative infection? A. Administer antibiotics as prescribed before the surgery. B. Provide the patient with pre-surgery dietary restrictions. C. Ensure the patient's consent form is signed. D. Ensure the patient is physically comfortable by adjusting their bed. Answer: A. Administer antibiotics as prescribed before the surgery. Rationale: administering antibiotics before surgery helps reduce the risk of postoperative infection by preventing bacterial contamination. 49. When a nurse observes signs of distress in a patient, what is the first step? A. Call for immediate medical intervention. B. Begin treatment based on the nurse's judgment. C. Assess the patient's condition and gather more information. D. Document the symptoms and wait for the doctor. Answer. C. Assess the patient's condition and gather more information. Rationale. The first action is to assess the patient's condition thoroughly to determine the appropriate course of action, whether it involves medical intervention or other treatments. 50. A nurse is caring for a terminally ill patient. What is the primary goal of nursing care in this situation? A. To extend the patient's life at all costs. B. To ensure comfort and manage symptoms. C. To provide the patient with experimental treatments. D. To focus only on the physical aspects of care. Answer. B. To ensure comfort and manage symptoms. Rationale. The primary goal in palliative care is to alleviate pain and ensure comfort, improving the quality of life for terminally ill patients. 51. What is the nurse's role in promoting patient safety? A. Ensuring the patient adheres to the prescribed treatment plan. B. Monitoring the patient for any signs of deterioration and taking corrective action. C. Encouraging patients to disregard prescribed safety measures. D. Focusing solely on clinical outcomes and disregarding the patient's environment. Answer. B. Monitoring the patient for any signs of deterioration and taking corrective action. Rationale. The nurse is responsible for monitoring the patient's condition and taking appropriate action to ensure their safety, including addressing any issues that may arise. 52. What should a nurse do when a patient expresses concerns about a proposed treatment? A. Ignore the concerns and proceed with the treatment. B. Acknowledge the concerns and provide more information to the patient. C. Tell the patient their concerns are not valid. D. Refer the patient to another healthcare professional. Answer. B. Acknowledge the concerns and provide more information to the patient. Rationale. The nurse should listen to the patient's concerns and provide additional information to help them make informed decisions about their treatment. 53. When assessing a patient's level of pain, which of the following is most important? A. The patient's verbal description of pain intensity. B. The nurse's observation of the patient's behavior. C. The patient's vital signs. D. The patient's past medical history. Answer. A. The patient's verbal description of pain intensity. Rationale. The most accurate measure of pain is the patient's own description of their pain intensity, which allows the nurse to assess and address it appropriately. 54. What is the most important action to take if a patient falls in a healthcare facility? A. Assist the patient in standing immediately. B. Call for help and do not attempt to move the patient until assistance arrives. C. Document the incident and wait for the physician to assess the situation. D. Reassure the patient and continue with the planned care. Answer. B. Call for help and do not attempt to move the patient until assistance arrives. Rationale. If a patient falls, it is crucial to prevent further injury by not moving the patient until a proper assessment is made by trained personnel. 55. When dealing with a patient who is angry or agitated, what is the most appropriate nursing action? A. Speak calmly and respectfully to de-escalate the situation. B. Avoid eye contact and walk away. C. Argue with the patient to defend the care plan. D. Ignore the patient's emotions and focus on the task at hand. Answer. A. Speak calmly and respectfully to de-escalate the situation. Rationale. Calm and respectful communication can help de-escalate anger or agitation, allowing the nurse to manage the situation effectively and maintain safety. 56. A nurse is caring for a patient with a history of asthma. What should the nurse do if the patient starts wheezing and having difficulty breathing? A. Immediately administer a bronchodilator as prescribed. B. Ask the patient to rest and calm down. C. Encourage the patient to continue activity to relieve symptoms. D. Wait for the physician to assess the patient. Answer. A. Immediately administer a bronchodilator as prescribed. Rationale. In an asthma attack, administering a prescribed bronchodilator is the immediate action to relieve symptoms and ensure the patient's airway remains open. 57. What is the most important consideration when a nurse is creating a care plan for a pediatric patient? A. The preferences of the child's parents. B. The child's understanding and ability to participate in the plan. C. The availability of pediatric-specific equipment. D. The nurse's own preferences based on prior experience. Answer. B. The child's understanding and ability to participate in the plan. Rationale. A pediatric care plan should be age-appropriate, involving the child as much as possible in the process to enhance understanding and cooperation. 58. What is the primary purpose of a nurse conducting a thorough assessment of a patient's health history? A. To establish a therapeutic relationship with the patient. B. To identify potential risks or conditions that may affect treatment. C. To fill out insurance paperwork. D. To understand the patient's preferences in relation to their diet. Answer. B. To identify potential risks or conditions that may affect treatment. Rationale. A comprehensive health history helps identify any conditions or risks that could influence the patient's care plan and treatment options. 59. If a nurse notices a pressure ulcer on a patient's heel, what is the first step in managing the ulcer? A. Apply a dressing and report it to the physician. B. Wash the wound with soap and water immediately. C. Assess the wound for severity and report it to the healthcare provider. D. Leave the wound exposed to air to speed up healing. Answer. C. Assess the wound for severity and report it to the healthcare provider. Rationale. The nurse should assess the wound's severity and then report it to the healthcare provider to determine the appropriate treatment. 60. When educating a patient about a new medication, what should the nurse include? A. The cost of the medication. B. The potential side effects and how to manage them. C. Only the dosage instructions. D. A detailed explanation of the medication's chemical composition. Answer. B. The potential side effects and how to manage them. 61. What is the most important factor in preventing hospital-acquired infections, HAIs? A. Using antiseptic solutions. B. Ensuring proper hand hygiene by healthcare workers. C. Wearing gloves during all patient interactions. D. Providing antibiotics to all patients. Answer. B. Ensuring proper hand hygiene by healthcare workers. Rationale. Proper hand hygiene is the most effective method of preventing the transmission of infections in healthcare settings. 62. Which of the following is an example of a patient-centered communication technique? A. Giving the patient detailed medical jargon. B. Asking open-ended questions and actively listening. C. Speaking in short, direct commands. D. Ignoring the patient's concerns to focus on medical tasks. Answer. B. Asking open-ended questions and actively listening. Rationale. Patient-centered communication emphasizes listening, understanding, and addressing the patient's individual concerns and preferences. 63. A nurse is providing care for a patient with a wound infection. What is the most important action to reduce the risk of further infection? A. Apply an antibiotic ointment to the wound regularly. B. Keep the wound covered with a sterile dressing. C. Change the patient's bed linens frequently. D. Ensure the patient consumes a high-protein diet. Answer. B. Keep the wound covered with a sterile dressing. Rationale. A sterile dressing helps protect the wound from further contamination and infection. 64. What is the primary focus of holistic nursing care? A. Addressing only the patient's physical health needs. B. Focusing solely on the patient's mental health. C. Caring for the patient's overall well-being, including physical, emotional, and spiritual health. D. Prioritizing medical treatments over emotional support. Answer. C. Caring for the patient's overall well-being, including physical, emotional, and spiritual health. Rationale. Holistic nursing focuses on the entire person, considering all aspects of health to promote healing and well-being. 65. A nurse is preparing to administer a blood transfusion. What is the first action the nurse should take? A. Verify the patient's identity and blood type. B. Prepare the blood product for infusion. C. Inform the patient about the procedure. D. Check the patient's vital signs before starting the transfusion. Answer. A. Verify the patient's identity and blood type. Rationale. Patient safety is a priority. Verifying the correct blood type and patient identity reduces the risk of transfusion reactions. 66. When caring for a patient with dementia, which approach is most helpful in managing challenging behavior? A. Using physical restraint to prevent harm. B. Providing clear, simple instructions and maintaining a calm demeanor. C. Ignoring the patient's behavior. D. Confronting the patient about their actions. Answer. B. Providing clear, simple instructions and maintaining a calm demeanor. Rationale. Clear communication and a calm approach can help reduce confusion and anxiety in patients with dementia. 67. A patient with a history of diabetes asks the nurse about managing blood sugar levels. What is the most important topic for the nurse to discuss? A. The importance of a healthy diet and regular exercise. B. How to use a glucose meter. C. The different types of insulin available. D. How to prepare for a hospital stay. Answer. A. The importance of a healthy diet and regular exercise. Rationale. Lifestyle changes such as diet and exercise are crucial in managing diabetes and maintaining healthy blood sugar levels. 68. What is the nurse's role in promoting effective pain management for a patient? A. To provide only medication for pain relief. B. To assess the patient's pain level regularly and offer appropriate interventions. C. To ignore the patient's reports of pain unless it becomes severe. D. To delegate all pain management responsibilities to the physician. Answer. B. To assess the patient's pain level regularly and offer appropriate interventions. Rationale. The nurse should regularly assess pain and intervene with appropriate pain management strategies to enhance comfort. 69. When caring for a patient with a wound, the nurse notices the wound is red, swollen, and has pus. What is the most likely cause of these symptoms? A. An allergic reaction to the dressing. B. A wound infection. C. A healing process complication. D. A new wound forming. Answer. B. A wound infection. Rationale. Redness, swelling, and pus are common signs of infection in a wound. 70. What should a nurse do if a patient refuses to take prescribed medication? A. Force the patient to take the medication. B. Respect the patient's decision and document the refusal. C. Ignore the patient's refusal and administer the medication later. D. Tell the patient they will get worse without the medication. Answer. B. Respect the patient's decision and document the refusal. Rationale. Respecting a patient's right to refuse medication and documenting the refusal is part of patient autonomy and legal compliance. 71. When caring for a patient who is experiencing anxiety, what is the best nursing intervention? A. Encourage the patient to ignore their feelings. B. Stay calm, provide reassurance, and help the patient identify coping mechanisms. C. Limit the patient's access to information about their condition. D. Redirect the patient's thoughts by offering distracting activities. Answer. B. Stay calm, provide reassurance, and help the patient identify coping mechanisms. Rationale. Providing reassurance and helping the patient cope with their anxiety is an essential nursing intervention. 72. A nurse notices a patient's blood pressure has dropped significantly. What is the first action the nurse should take? A. Notify the healthcare provider immediately. B. Reassess the patient's blood pressure in 10 minutes. C. Position the patient in a supine position and elevate the legs. D. Give the patient more fluids and monitor the pressure. Answer. C. Position the patient in a supine position and elevate the legs. Rationale. Positioning the patient correctly can help improve circulation and raise blood pressure temporarily until further action is taken. 73. What is the best way for a nurse to ensure effective communication with a patient who speaks a different language? A. Use family members as interpreters. B. Provide written instructions in the patient's native language. C. Use a professional interpreter service or language line. D. Speak slowly and loudly to the patient. Answer. C. Use a professional interpreter service or language line. Rationale. Professional interpreter services ensure accurate communication between the nurse and patient, reducing misunderstanding. 74. A patient has expressed the desire to discontinue a specific treatment. What is the nurse's responsibility in this situation? A. Convince the patient to continue the treatment. B. Inform the healthcare provider and document the patient's decision. C. Ignore the patient's request and proceed with the treatment. D. Stop the treatment immediately. Answer. B. Inform the healthcare provider and document the patient's decision. Rationale. The nurse must respect the patient's wishes, inform the healthcare provider, and document the decision to ensure continuity of care and compliance with legal standards. 75. When a nurse is caring for a patient receiving chemotherapy, what is the primary concern regarding the patient's safety? A. Ensuring the patient receives adequate hydration. B. Monitoring for signs of infection due to immunosuppression. C. Managing the patient's pain levels. D. Ensuring the patient gets adequate nutrition. Answer. B. Monitoring for signs of infection due to immunosuppression. Rationale. Chemotherapy weakens the immune system, making patients more susceptible to infections, so monitoring for signs of infection is crucial. 76. What is the nurse's role when educating a patient with a new diagnosis of hypertension? A. Explain the medical terminology used in the diagnosis. B. Provide information on lifestyle changes, medication adherence, and follow-up care. C. Discourage the patient from seeking additional opinions. D. Focus only on the prescribed medications. Answer. B. Provide information on lifestyle changes, medication adherence, and follow-up care. Rationale. Comprehensive education about lifestyle changes, medication adherence, and follow-up care helps patients manage hypertension effectively. 77. A nurse is caring for a patient who is experiencing shortness of breath. What is the first action the nurse should take? A. Administer oxygen as prescribed. B. Place the patient in a semi-Fowler's position. C. Ask the patient to lie flat and rest. D. Call the physician immediately. Answer. B. Place the patient in a semi-Fowler's position. Rationale. The semi-Fowler's position can help relieve shortness of breath by promoting lung expansion. 78. A nurse is caring for a patient with a cast on their leg. What is the best action to prevent complications such as skin breakdown? A. Keep the cast dry and clean. B. Allow the patient to walk on the cast for longer periods. C. Tighten the cast to improve support. D. Use lotions around the edges of the cast to soothe the skin. Answer. A. Keep the cast dry and clean. Rationale. Keeping the cast clean and dry is crucial to preventing infection and skin breakdown. 79. What is the nurse's primary responsibility when caring for a patient with a central venous catheter, CVC? A. Administer the prescribed medications and fluids through the catheter. B. Regularly monitor the insertion site for signs of infection or complications. C. Only flush the catheter when it is necessary for medication. D. Ensure that only physicians handle the catheter. Answer. B. Regularly monitor the insertion site for signs of infection or complications. Rationale. Regular monitoring for infection or complications is critical in patients with central venous catheters to prevent serious complications. 80. A nurse is educating a patient about smoking cessation. Which of the following is an important point to include in the teaching? A. Nicotine withdrawal will only last for a few hours. B. It is common to gain weight when quitting smoking. C. Quitting smoking will have immediate health benefits. D. Smoking cessation will only improve the patient's lungs, not their overall health. Answer. C. Quitting smoking will have immediate health benefits. Rationale. Smoking cessation has immediate health benefits, including improved lung function and decreased risk of cardiovascular disease.